Hi, my name is Carissa. I am creating a channel all about social work. The reason that I'm doing this is, well, I've actually been thinking about doing this for like ever, and there's always a reason why I don't do it. Either I don't have the right space to do it, or not the right lighting, or I'm nervous, and what are people going to think, and all of these different things. And it's just come to a point where I am now making changes in my career, and I wish I had some guidance on like how to prepare for the LCSW exam, because I've finished my hours and now I'm preparing to study and it's really difficult. I wish I understood like how do people create private practice? How do you know which career to go into as far as like, do I want to work in a hospital? Do I want to work in a school? Do I want to work in a private practice? Do I want my own private practice, or do I want a group practice? There's all of these different things that contribute to these decisions, and I have found that I don't have enough information on it. And so I thought, you know what? It might not be the perfect setting and everything like that, but hopefully as I'm going through this, I can teach other people. So we're going to start with the basics for today. What is therapy? So for me, I have done therapy in different settings, and I started off working with adults in an FSP program. Then I worked with adolescents in an STRTP program, and now I'm working for a private practice. I will go into in other videos like what is FSP, what is STRTP, what are these different places that I worked for. But for this, ultimately what I ended up doing was going into therapy, because social workers don't have to be therapists. And I could make a video on all the different things that you can do. Like I said, you could work in a school, you can work in a hospital, you can work in a jail, you could work in nonprofit, community-based, you could do research, there's so many different things that you could do. For me, I chose to go the clinical route. I've been doing therapy now for about 3 years, and even that in itself has been a journey, because it's not just one population. Like at one point I was working with adults, then I was working specifically with adolescents. Now I have adults and adolescents, so it's a little all over the place, but you can specifically pick what you like. Some people like family therapy, they like couples therapy. Everything that I'm doing right now is individual therapy, but in the past I have done family therapy. You could kind of pick and choose what your specialties are, but it kind of depends on like what you want, what are you looking for, and what are the settings, because in some settings you can't choose. Like I've worked for agencies where I've had to do group therapy. It is what it is. I don't have a choice. My current agency, I choose to do only individual, although there is a group setting that I could work for. So what is therapy? If you're in individual therapy, a lot of times it is kind of what this is. This is actually where I do therapy, because I do virtual therapy now. I'm no longer in an office in person. So if you were to meet with me, this is what you see. This is the background that you see all the time. I'm looking at the screen and I'm talking to the person. A lot of times therapy is just led by whatever that person is coming to therapy for. So it's not specific. It's not like I could do the same exact intervention for every single person that walks through the door or the screen. It kind of depends. Like, is somebody struggling with depression? Is somebody struggling with anxiety, bipolar disorder? There's all of these different disorders that need different types of interventions. So just for example, anxiety a lot of times works well with CBT. Personality disorders work well with DBT. There are a lot of different things, which I can also get into in other videos, but for the most part, if you're looking for a therapist and you want individual time, you usually book, depending on the therapist or the agency, either 45 minutes or 60 minutes. You can do a session once a week, every other week. It kind of depends on the frequency and severity of the symptoms and what you need. Some people, they start off with twice a week if they're going through a crisis. For example, somebody's mom had passed away. It was new, it was recent, it was a grieving process, so twice a week was appropriate. As time went on, they go down to once a week, and then potentially every other week. It kind of depends on the person and the symptoms. So you sign up for a therapist and you get matched with somebody, or you pick the person that you want depending on how it goes. You sit down. There's usually an intake process, which means you come to session and it's a little bit more formal. It's like, what are you here for? What are you looking to address? What are some of your coping skills? What helps the situation? What doesn't help the situation? Usually we'll ask for family history. Is there any mental illness or mental health issues that run within your family that could potentially be passed down to you? So on and so forth. Sometimes there's really personal questions. A lot of times we ask about childhood trauma. Is there anything, it doesn't have to be childhood, but is there any trauma that has happened that has significantly impacted you? And if so, let's talk about that, because if you're experiencing anxiety, most likely it stems from somewhere. So there's a lot of times where we will ask about trauma. I will put it out there, and I always put it out there to my clients. If you're in your first session and you don't know me, there is absolutely no reason why I should expect for you to just put everything out on the table. That could be a very vulnerable situation. You want to make sure that you build rapport and things like that first. So if you're in a situation where either you're the therapist and somebody doesn't want to answer the question, or you're the client and you don't want to answer the question, it's okay. It's not personal. So I like to put it out there, hey, look, it's okay if you don't want to answer this question. That is understandable. And it takes time to build rapport and trust. Hopefully the goal is that you will come to a point where you trust me, and then you'll be able to have a conversation about some of these more difficult topics. But nonetheless, the beginning is a lot of just gathering information. Where is this stemming from? What does this feel like? What are the symptoms you're experiencing? And depending on the agency, your first session will have an intake that I'm talking about, and also a treatment plan. So you'll come up with some goals. So they can be very simple, like I want to work on decreasing my anxiety. Or it could be more complex. I want to work on increasing my appropriate communication skills from 1 time a week to 3 times a week. I mean, it really depends on the client and the situation, but usually you set goals in that first session. If it's not done in the first session, it's going to have to be done in the next session, because ultimately you want to know, like, what are we working towards and how do we measure it? So that's the beginning of therapy. And then from there, it kind of goes in different situations depending on the person. So sometimes I come to session, I have people who they just want to be heard. They show up, they talk about what happened during the week, we kind of process it, and that's it. For some people, they really want to strategize, come up with plans, come up with coping skills, how to be more productive, scheduling. So the need and the way that the session flows depends on what the person is looking for. And it also depends on whatever happened in between seeing you this time and the next time, right? Because if things are going well, then maybe we're having conversations just about like the past, you know, what happened in the past, where does this stem from? Like, we're going back, we're not really talking about now. But if you come to a session and you're upset, visibly upset, I could see maybe you start becoming tearful or crying. Obviously, we have to shift now. We don't want to talk about the past. We want to talk about what happened between now and the last time I saw you. So, you know, therapy is difficult because everybody is different. So I can't say exactly what you can do every time. If you're a client and you're looking for a therapist, there's a lot of different things you want to look for. Do I feel like this is working? Do I feel like I can trust this person? If you can't, that's okay. Not everybody is a match. Just like in the regular world, you're not going to become best friends with every person that you meet, right? Okay, so if you come across a therapist and you feel like you're not connecting, that's normal as well, because we don't connect with every single person we come across, and different people vibe for different reasons. So it's okay if it takes 1, 2, 3 tries before you find the person that you feel comfortable with. Therapy is difficult because sometimes it feels good. It feels good to let it all out. It feels good to have somebody to support you. At the same time, sometimes it doesn't feel good because you leave session and you're like, wait a minute. I just rehashed a bunch of stuff from the past that I haven't thought about in a long time. My anxiety's through the roof because I don't know how to get these thoughts to stop. So you're not always going to leave session feeling great. And that's important to say, because sometimes people think, oh, I'm going to go to therapy and I'm just going to let it all out and it's going to be fine and it's going to fix everything and they're going to tell me exactly what to do. That's not how that goes. Sometimes it goes like that, but also a lot of times it doesn't. So sometimes the question becomes, is therapy for everyone? I'm biased, I'm a therapist, but I'm going to say yes. No matter who you are and what you've been through, there is always room for improvement. Do you have to be in therapy? No, you don't have to be in therapy. But if you're in a position where you're wondering, should I go to therapy? If there's something inside of you that thinks that maybe you want to try it out, try it out. What do you have to lose? Besides some money, because a lot of times it costs money, unless if you have a certain type of insurance that maybe covers all of it. A lot of times it costs money. So Put that to the side though. If you feel like there are things that you want to work out, you want to process, you want to understand better, it's okay. You don't only go to therapy because of a crisis happening. There are people who just go, they're like, hey, I want to process this, I want to work on myself, I want to be better, I want to feel better, and that's okay. Ultimately, it's your decision what you want to do. When you are in therapy, and we're talking about your decision, obviously if you went to if you got arrested, went to court, had a hospitalization, and some judge or somebody, probation officer, told you have to go to therapy, that's completely different. But if you are choosing to go to therapy, once you go, you are not locked in forever. You don't have to commit to, I'm gonna do this for a year, right? So you go in, see how it goes. You always have the right to say, this isn't working for me. I want to either try a different therapist, or I'm just done with therapy. It is okay to do that. That is your right. You have the decision to do what you need to do for yourself. Therapy takes a lot of courage. It's not easy to show up and have to talk about sensitive topics. So all that I could say is, if you're thinking about going to therapy, give it a try. If you're a therapist or if you're a social worker and you're thinking that you might want to take this route, you can give it a try. I think ultimately everybody is different. There's no one solution. So in order to know, you have to try. And like I said, I will work on other videos as well, because I want to be able to get into more details, because it's not only individual therapy. Like, what about group therapy? There's substance abuse groups, there's anger management groups, there's all these different types of group that you can also take, which have their own set of benefits. Of course, it's great to sit down one-on-one, it's more personalized, but at the same time, you might want to create a support network. You might want to be able to connect to other people who are experiencing something similar to you. So this is just specifically for like what is individual traditional therapy. There are other types of therapy out there beyond just talk therapy. So this is the beginning. I hope that it was helpful. Please, if you are interested in any of this, leave comments about what you want to see, because as this channel continues to grow, it's only going to be beneficial if I know what people want to see. What are people actually looking for? So please give me some guidance. I'm open to suggestions, and I'm going to continue to work and just make different videos for different things, and hopefully it helps clients or people out there that are looking to understand therapy, and also helps people that are on a similar journey to me, where it's like, what am I doing with this social work degree? How am I getting this LCSW? Different acronyms for different states. But it's all a journey for all of us. So I'm hoping I can create an atmosphere where I'm very helpful for everybody, and I will see you in the next video. Thank you.